So in trying to talk about the acute coronary syndrome, it's good for us to still refresh our memory on the anatomy of the heart, because it's been long we did anatomy on this channel. So it's good so that we refresh our memory to just follow up on anatomy and all of that. Okay, so be looking at what the anatomy of the heart as related to what acute coronary syndrome. Anatomy of the heart as related to acute coronary syndrome. So looking at this now, we have so many images. I will be looking at all the basics that we actually need to remember about the heart before we start talking about acute coronary syndrome. So the heart is actually what a muscular organ that pumps blood throughout the body. So in relation to acute coronary syndrome, the following anatomical structures are actually relevant for you to actually still remember. So you actually still look at the coronary arteries. So you can look here, and this is the left coronary artery, this is the right coronary artery. Okay, so the two main coronary arteries branch off from the aorta, supplying blood to the heart muscles. We have the left coronary artery, then we have the right coronary artery. Okay, then for the left coronary artery, it divides into the left anterior descending artery and the left circumflex artery. Okay, so left anterior descending and left circumflex, you get. Okay, then for the right now, right coronary divides into the right marginal artery and the posterior descending artery. Okay, so this is the right marginal artery, but the posterior descending, you know that it's at the back. So this image is at an anterior view, so it's not there. Okay, but you can use your atlas to visualize it. Okay, for the posterior descending artery. Then also, it's good for us to remember the myocardium. You know, the myocardium is actually what? The heart muscle, which receives blood from the coronary artery. Endocardium is the innermost layer of the heart, actually lining the chambers and the valves. Epicardium is the outermost layer of the heart surrounding the myocardium. Okay. Then in acute coronary syndrome, coronary arteries become what? Narrowed. That's it becomes stenotic. Okay. And this is due to a plaque buildup, that's atherosclerosis. Okay, they could become blocked. I didn't bring the picture here, but if you watch my other videos of acute coronary syndrome, you get to see that what there is block in it. Okay, there's a block in it. Okay, so it becomes blocked by a blood clot, that's a thrombus, leading to what? Reduced blood flow to the myocardium. Then there's ischemia, that's reduced oxygen supply to the muscles. Then if this reduced oxygen supply to the muscles continues for a very long time, it might ultimately lead to what? Infarction, which is a cell death. Okay, so understanding the anatomy of the heart and coronary arteries is crucial for our discussion in acute coronary syndrome. Okay, so this is just a revision, and I hope you see you guys in the lectures to come.